Today is the deadline with no flu shot or exemption form. Employees are facing a 2-week suspension, and if they still don't get a flu shot, they'll be fired. Now, out of the 1,600 employees at the Waterbury Hospital, 120 of them have yet to get it. Karen McKinnon has been suspended from her job without pay for refusing to get the flu shot.
It's a violation of my rights. And I don't believe any employer should force, coerce, or threaten any employee to receive a vaccination they are opposed to just to keep their job.
An OR nursing assistant for 32 years, she says she hasn't gotten a vaccine in 18 years because last time it made her sick. She's wary of some of the ingredients, formaldehyde, mercury, aluminum, and says they scrub thoroughly in the OR and wear masks. Dr. Stephen Aronin, chief of the infectious disease section, says that's not enough.
Anybody who works at Waterbury Hospital, who goes into our cafeteria, who walks the halls of our hospital, could have the flu, leave it on an inanimate object, and have somebody else who does take care of the immunocompromised person in the ICU, they could pick it up and bring it on to their patients.
Waterbury Hospital is one of 19 in the state that's now making flu vaccines mandatory. And Karen McKinnon isn't the only one balking at it.
We are America, a free country. It's our body. We know what's wrong. We know how we feel.
I'm more than willing to wear a mask, you know. I'm more than willing to take other measures. I just really prefer not to be injected with a substance that may have risks that I'm not prepared for. There's a risk of death with the flu shot.
The union says they do believe people should get flu shots, but they don't believe it should be mandatory. And they're now filing a grievance saying it violates federal labor laws and HIPAA because employees' tags now show their flu shot status with this yellow sticker.
All of a sudden, it's not so private.
The hospital says patient care trumps their right to choose.
There are other things that we ask of our employees. There are things that all employees have to do. When they get hired by Waterbury Hospital, they need to show that they've been vaccinated against measles, mumps, and rubella.
There are exemptions allowed, a severe egg allergy, and if you've had a history of bad reactions to the shot, if you do get an exemption, you would have to wear a mask at all times. None of the workers that we spoke to have yet to make a final decision. Live in News 8 Control, Annie Rourke.